Thank you very much for joining our Facebook Live. My name is Saida Swaleh, a communications expert and a media relations officer based in Brazzaville, Congo, at the WHO regional offices. Today, we're diving into the heart of a disease that has affected millions of lives in Africa, Onchocerciasis, also known as river blindness. Transmitted by tiny black flies living on the banks of rivers, it can cause intense itching, skin lesions, and in the most severe cases, loss of sight. During this discussion with our expert, we will discover how a tiny fly can turn lives upside down and how, thanks to continuous efforts and mass treatments, onchocerciasis is finally declining in several affected regions. With me today is Dr. Didier, whom I will allow to introduce himself. Thank you.
Thank you so much, madam. My name is Didier Bakajika. I'm a public health physician by training. I work with WHO, the Expanded Special Program for Elimination of NTDs, where I'm in charge of onchocerciasis and onchocerciasis and lymphatic filariasis.
Thank you very much. And when he says NTDs, he means neglected tropical diseases.
Yes.
Thank you. So, doctor, to begin us, to start off this conversation, what is onchocerciasis?
Onchocerciasis is a parasitic, neglected tropical disease caused by a filarial worm called Onchocerca virulus. The filarial worm is transmitted by a tiny fly, black fly, called Similium.
Thank you. You just spoke about the transmission, and what do we know about the symptoms? When somebody is bitten by this fly, what happens?
When someone is bitten by the fly, it takes between 1 to 3 years. That's what we call the incubation period. After 1 to 3 years, some people will develop some symptoms. You mentioned in your introduction severe itching that will lead to skin lesions. The skin lesions may lead also to, the disease can also evolve to other lesions in the eyes, what we call the eye lesions. There are many, depending on which part of the eye is affected. And if nothing is done, the final outcome is the irreversible blindness. These are, in summary, some of the signs of onchocerciasis as a disease.
Okay. For the sake of those who are listening in, how can one differentiate this from, let's say, a mosquito, the fly itself? You know, because when somebody is bitten by a mosquito, the rash or the lesion that appears on the skin is almost quite similar to what you're saying. So how can one differentiate?
No, it's not similar. When you are bitten, you may feel a bit of pain, but later on, you think that everything is fine. But after quite a number of years, as I mentioned, the incubation periods, some people will develop those signs that I mentioned, but some will remain asymptomatic their entire life. So it's not a mosquito, it's a tiny fly, which is completely different to a mosquito.
Thank you very much. And which countries in the region are still affected by this?
We do have in the WHO African region 27 countries out of 47. So out of the 27, they are scattered in different parts of the WHO African region. We have some countries endemic, non-endemic in West Africa, a country like Mali, a country like Senegal, a country like Burkina Faso, a country like Benin, Togo. We also have endemic countries in Central Africa, Cameroon, DRC, Congo-Brazzaville, Gabon. We have endemic countries in West Africa. We have Ethiopia. We have Uganda. And we have also countries in Southern Africa, a country like Malawi, a country like Tanzania. So that's to give you a big picture in terms of countries that are endemic in the WHO African region. We have 27 as of December 2024, 27 out of 47 countries.
Thank you very much. And what does the treatment look like? How does the treatment work, and who should take it?
Okay, this is a disease that will remain endemic in a setting. And when mapping surveys are conducted to determine whether a setting is endemic or not, once the endemicity is confirmed, it means that people living in that endemic setting must be treated, regardless of them having symptoms or not. Mm-hmm. As I mentioned earlier, you have the blackfly coming, biting, and transmitting the parasites. Mm-hmm. So the blackfly will not differentiate who has the parasite or who doesn't have the parasites. That's the reason why we treat people residing, living in the endemic setting. The treatment, there's a drug which is donated free of charge by one pharmaceutical company. And that drug is given to anyone living in the endemic setting starting from 6 years and above. It can be given once a year. In some part of Africa, it has been given twice a year. In the Pan-American Health Organization region, like in Colombia, in Ecuador, in Mexico, Venezuela, and Brazil, the drug was given even 3 times or 4 times a year. But the minimum is once a year. Mm-hmm. If it's twice a year, so the first treatment and the second treatment should be given after 6 months.
Okay.
If it's 3 times a year, it's after 4 months. And if it's 4 times a year, it's after 3 months. But overall, it's once a year. But depending on how the disease is endemic in some settings, the country can decide to distribute the drug twice a year. And the drug is available free of charge, provided by the pharmaceutical company.
In the interest of those listening, for those who may have heard what you've just said and they are worrying and they end up taking this drug more than the recommended dose, are there any risks involved?
There is always a risk when you take a drug and you go beyond the recommended dose. So you have to be very careful and avoid getting the drug and treating yourself without following the recommended dose. Mm-hmm. The scenarios that I mentioned 2 times, 3 times, or 4 times a year, these scenarios were adopted based on the burden with the disease in some of those settings. So it's not deliberate that someone will go and decide to take 3 times, 4 times, 6 times. No, not at all. Mm-hmm. There's always a risk when you go beyond the recommended dose.
Thank you very much. And what results have been achieved in the recent years during mass administration of the drugs?
Yes, a lot has been achieved. We have in the WHO African region one country that has been recognized by WHO as having eliminated the transmission of Onchocerciasis. This is Niger. Niger was recognized by WHO last year after nearly 50 years of interventions. Regarding the countries that are still endemic, as I mentioned, we have 27 countries currently endemic if we remove Niger. In 7 of these countries, mass drug administration campaigns have been stopped in 205 districts. I'm going to list a few districts in a few countries where mass drug administration campaigns were stopped. Mm-hmm. We have in Equatorial Guinea, the mass drug administration has been stopped in 4 districts. You go to Ethiopia, the mass drug administration has been stopped in 26 districts. You go to Mali, the MDA was stopped in 2 districts. You go to Senegal, the MDA has been stopped in the entire country in 8 districts. You go to Togo, the MDA was stopped in 4. Nigeria, the MDA as of December 2024 was stopped in 123 districts. And in Uganda, the MDA has stopped in 38 districts. So in total, as of December 2024, MDA has been stopped in 205 districts. In terms of progress, the total number of people living in districts that stopped MDA was nearly around 24.5 million people no longer requiring treatments. So that means that a lot has been achieved and countries are making progress towards the elimination of onchocerciasis.
Wow, this is very interesting, and these are remarkable numbers. However, in every success, there must be a few challenges. And you're able to list for us some of the persistent challenges that you've seen in these endemic countries?
Yeah, as you mentioned, there are always some challenges. I'm going to list some of them. We have, for instance, the adherence of communities to treatment. In some of the places, the adherence is very low. And as you can guess, when you have some people swallowing drugs and other not swallowing drugs, they become a kind of reservoir. And when the blackfly comes for his blood meal, the blackfly is not going to differentiate who's swallowing and who's not swallowing the drugs.
Yeah.
And those who are reservoir, the blackfly will go there and pick the microfilaria. We have adherence to treatment. In some of the places, the adherence is very low. We have financial constraint. Yes, the drug is donated free of charge, but to implement those campaigns, we always have the logistic behind. We need some funding to be able to plan to implement. In some of the places, the mass drug administration campaigns programs were not able to implement those campaigns due to financial constraint. We also have another challenge, mainly in Central Africa, where we have another type of filariasis called loasis. This filarial worm is causing a lot of issues because those having both onchocerciasis and loa, they are not eligible to take the donated drug because of adverse event, which can also evolve to serious adverse events. Strategies are being developed to see how we can treat in these specific settings. So there are a lot of challenges, but we have also how to reach settings, how to reach areas, people living in remote places, and they cannot be reached easily. Yeah. So these are some of the few challenges I can mention to you, but countries together with partners are working together to overcome some of those challenges and progress towards the elimination of onchocerciasis.
Thank you very much. And from the successes you initially listed, or the numbers of millions of people who have been given the drugs, how has the WHO contributed to these successes?
The contribution of WHO has been instrumental and phenomenal. Let me take you back 52 years ago. WHO has been instrumental in putting together a consortium of partners to establish the first control program called OCP, Onchocerciasis Control Program in West Africa. And WHO, together with other donors like the World Bank, the UNDP, and the WHO TDR, were able to bring together donors, to bring together countries to support the fight against onchocerciasis. The program closed in 1994. In 1995, another program was established called the African Program for Onchocerciasis Control, bringing together donors, implementing partners, countries willing to come and willing to support. APOC, African Program for Onchocerciasis Control, did a tremendous job from 1995 up to 2050. Results are remarkable. There are publications on the impact of the APOC on the transmission, on the interruption of transmission in few places in the African region. From 2017 up to date, WHO ESPAN is supporting countries working together with donors. So WHO has been instrumental in bringing together donors, in advocating, in mobilizing resources so that we can come together and we can provide our support to countries to fight and eliminate onchocerciasis as a problem.
Thank you very much. Any final thoughts?
Any final thoughts? We are making tremendous progress towards the elimination of onchocerciasis, as I mentioned. Out of 250.6 million people requiring treatment, we treated 171.5 million in 2024. We stopped MDA in 205 implementation units. In total, 24.5 million people do no longer require treatment. So the result can speak from themselves. But we have a lot of challenges. We should come together. We should put our resources together with countries so that we can support them and make tremendous progress towards the elimination of onchocerciasis, as mentioned in the WHO NTD roadmap. By 2030, the target is to verify at least 12 countries globally. So we hope that I strongly believe that if we put our resources together, we can reach the target and kick out onchocerciasis, not only in the WHO African region, in the EMER region, and also in the 2 remaining countries in the Pan-American Health Organization region.
Thank you very much, Dr. Didier. Thank you for your time.
It was a pleasure.
Yes, thank you very much.
Thank you.
The key message today is clear. A disease once greatly feared is now on the decline, thanks to widespread treatment efforts, strong community engagement, and the sustained commitment of health programs, communities, and donors. Together, we are building a future where onchocerciasis is no longer a threat and no longer threatens generations to come. Thank you for your time. My name is Saida Swaleh. Until next time, bye.